Hispanic Folk Medicine and Traditional Healing by Shauna Cowdery and Laura Denny. Spanish 120, Culture Presentation. Religious and spiritual beliefs play an important role in the cultural values and traditions of Hispanic groups in the United States. Even though cultural awareness is recognized as an important issue by the medical community, there is a lack of knowledge regarding specific health promotion practices. When providing a holistic approach to healthcare, it is important for medical professionals to understand the patient's perception of health and well-being, which can vary based on the individual and is often affected by cultural beliefs. Why is it important to understand a patient's spiritual and cultural beliefs? An individual's cultural beliefs and/or spirituality may play a large part in their understanding of health states and disease processes. They may affect an individual's health-related decisions, and spiritual beliefs may play an integral role in the patient's ability to cope. Taking the first step to providing culturally competent care involves becoming familiar with commonly held beliefs and practices. So let's get started, or better said, empecemos. When attempting to gain a better understanding of folk illnesses and their treatments, it is muy importante to be familiar with folk healers you may encounter and their role in traditional healing. Yerberos specialize in the use of medicinal plants and herbs. Their role is similar to that of a pharmacist. Curanderos practice a holistic form of healing called curanderismo. This type of folk healing combines prayer, herbal remedies, rituals, psychic healing, spiritualism, and massage. They often identify illnesses as either hot or cold. We will discuss this concept further in the next slide. Brujos, wizards or witches that are consulted for unnatural or supernatural conditions. Sabadores, similar to physical therapists, they are trained to promote healing through massage and are also known to perform bone manipulations, much like that of a chiropractor. Pataras, midwives who give guidance to pregnant women and oversee births. Many folk illnesses are thought to be caused by an imbalance of hot and cold within the body. To resolve the illness, the individual must use a treatment that is opposite in temperature. This has potential to cause issues with conventional medical treatments. For example, penicillin is considered a hot medication and culturally speaking should only be taken for cold illnesses. If this medication were to be prescribed to an individual with a fever, they may be less likely to comply with the prescribed treatment. Next, we will review 4 of the most common folk illnesses, their symptoms, treatments, and nursing considerations. Caída de mollera primarily affects children under the age of 2, however, it has been diagnosed in older individuals. The cause is thought to be mechanical in nature, such as pulling a baby away from the breast or bottle too quickly, dropping the baby, or carrying the baby incorrectly. Symptoms include inconsolable crying, fever, irritability, sunken eyes, trouble feeding, vomiting, or diarrhea. A folk healer may recommend pushing on the baby's palate with a finger, holding the baby upside down over a pan of water and slapping the bottom of the baby's feet, or applying a poultice to the fontanelle. The reason for the above symptoms could be any number of illnesses and can result in extreme weight loss or worse. From a medical perspective, it is important to identify and treat the underlying cause. Keep in mind the mother of a child with caída de mollera may experience a significant amount of guilt due to this illness culturally being seen as a sign of neglect. Additional reassurance and education will likely be needed. Oral rehydration, antibiotics, or even IV therapy may be indicated. Muy importante questions to ask when treating a child with caída de mollera. How many wet diapers today? ¿Cuántos pañales mojados hoy? How many times a day is your child eating? ¿Cuántas veces al día está comiendo su hijo? Any vomiting or diarrhea? Cualquier vómito o diarrhea? Is the child having trouble eating? El niño tiene problemas para comer? Susto, also known as fright sickness or soul loss, is thought to be caused by supernatural powers and can be related to an individual experiencing a frightening, embarrassing, or otherwise traumatic event. Symptoms include lethargy, depression, insomnia, loss of appetite, hallucinations, and mood instability. If the case of susto is mild, then it can be treated with herbal teas and prayer, while more serious cases may require assistance from a curandero to perform a cleansing ceremony. Some of these ceremonies are called a limpieza or a barrido, and it involves brushing a ceremonial broom over the body of the sufferer. Keep in mind it is always important to perform a suicide screening and to educate the patient about available community resources. Words that are helpful to know when caring for an individual with susto. Depresión, depression. Ansiedad, anxiety. Alucinaciones, hallucinations. Insomnio, insomnia. Suicida, suicidal.
Empacho is a folk illness that is a type of stomach upset that is believed to be caused by undigested food getting stuck to the walls of the stomach or the intestines, causing an obstruction. Symptoms may include anorexia, dehydration, bloating, cramps, and severe stomach aches. Causes can include excessive eating, not chewing food completely, consuming spoiled foods, eating at the wrong time of day, or combining the wrong foods. Treatment for empacho includes dietary restriction, consuming herbal teas such as rose petal, catnip, wormwood, or chamomile tea, an abdominal or back massage with olive oil, and pinching the skin on the back and pulling it until it pops. One popular treatment usually used in kids is the administration of lead-based powders such as azacanor greta or albayalde. Unfortunately, this treatment is not recommended because it exposes individuals to harmful levels of lead that could result in lead poisoning. When individuals get empacho, they may ask themselves, well, how did I get this? They can ask themselves a few questions. Did I swallow gum or an excessive amount of saliva? Was I forced to eat something when I wasn't hungry? Did I eat too much? Well, according to the Mayo Clinic, empacho is rarely caused by the ingestion of food, but is instead caused by disease processes such as intestinal adhesions, hernias, tumors, Crohn's disease, twisting of the intestines, impacted feces, or scarring. If empacho is suspected, a folk healer confirms the condition by rolling a fresh chicken egg over the abdomen. If the egg appears to stick to any one particular area, that is where the empacho is stemming from. Modern-day treatment of an intestinal blockage should include a medical professional to avoid severe complications. Diagnostic imaging is the only way to determine the cause of an intestinal blockage. If an individual only has a partial blockage, sometimes a low-fiber diet is the only necessary treatment. Full obstruction requires surgical intervention. Here are some important words to consider for empacho. Dolor de barriga, stomachache. Obstrucción estomacal, stomach obstruction. Vómitos y diarrea, vomiting and diarrhea. Hinchazón y calambres, bloating and cramps. Indigestion, indigestion. Te tragaste chicle, did you swallow gum? Comiste comida estropeada, did you eat spoiled food? Comiste demasiada comida, did you eat too much food? And beber te ayudará con los síntomas. Drinking tea will help with the symptoms. Mal de ojo is another folk illness and is one of the most commonly reported folk illnesses reported by Hispanic parents. It usually occurs in children. It is caused by a person with a quote-unquote strong eye who admires a child without touching them. This can occur intentionally or unintentionally, and though it sounds as if it is inflicted through malice, it is not. The illness is believed to occur because a spell has been placed on a child by a person who secretly admires and covets him or her. To counteract this effect of the admiration, the admirer must touch the object of strong admiration. The strong eye causes the blood of the child to heat up and may cause fever, inconsolable crying, vomiting, diarrhea, aches and pains, and a gassy stomach. For treatment, the parent should take their child to a folk healer for herbal remedies and ritual cures. One ritual cure is the act of passing an egg over the body and then placing it in a bowl under the child's pillow overnight. If the egg is cooked in the morning, then the child had mal de ojo and it is now cured. Sometimes a lemon or chili pepper is used in place of an egg. Another treatment for mal de ojo is for the strong person to move their hand over the forehead of the weakened individual. Some Latino parents may also place an amulet on infants known as azabache, which is worn on a necklace or bracelet and is believed to protect against mal de ojo. To avoid mal de ojo, it is recommended that when visiting small infants or children, that the individual place their hands on the child while admiring them. Some important words to consider for mal de ojo: deshidración, dehydration; vómitos y diarrea, vomiting and diarrhea; aumento de la agudeza, increased fussiness; dolor de estómago, stomach pain; and miedo y enojo, fear and anger. This table provides several remedies that are used in Hispanic communities for both folk and medical illnesses. A few examples: manzanilla or chamomile can be used for nausea, gas, colic, and anxiety. Herba buena or spearmint can be used for indigestion, gas, colic, or susto. And zapila or aloe vera can be used for cuts, burns, and as an immune stimulant. It is important to understand that Hispanic individuals who are sick may simultaneously be using prayer, folk and herbal medicine, prescription medications obtained from a friend, and prescription medications prescribed by a doctor. Regardless of the type of care they choose to receive, the patient and their families are likely to include their faith in God as a vital component of understanding the problem and the cure.